Production and distribution of City Club forums on ideastream are made possible by the generous support of PNC and the Raskin Family Fund, with additional funding from Cleveland State University, Robert Conrad, and the Payne Fund.
Good afternoon and welcome to the City Club of Cleveland. I'm Darrielle Snipes. I'm a reporter-producer at ideastream, the NPR and PBS stations here in Cleveland. It's my pleasure to introduce today's forum, a panel discussion on food insecurity in Ohio. In 2006, food insecurity supplanted hunger as the way the United States government describes Americans who don't have enough food to eat. No matter what term is used, while society and technology have accelerated, so has the number of people going hungry, increasing by 57% since the late 1990s. Today, you can find hunger where you least expect it. It's in the homes of senior citizens, in suburbs, on college campuses. Overall, 1 in 6 Americans don't have enough to eat. Ohio, with one of the nation's highest food insecurity rates at 16.1%, is not immune to these trends. Here in Cleveland, this might seem unbelievable. We're home to celebrity chefs, renowned restaurants, a plethora of farmers markets, and are often referred to as a culinary hotspot of the Midwest. We seem to have an abundance of food, yet our friends and neighbors are still going hungry. There are many local efforts in place. In 2017, Harvest for Hunger campaign, a collaborative effort between 4 Northeast Ohio food banks that serve 21 counties. It ended last week and raised enough money to provide 21.6 million meals to greater Clevelanders. What else can be done? Individuals assembled on stage here are examples of innovative solutions to our region's food insecurity problem. Joining me on stage are Nicole Debose, County Extension Director at the Cuyahoga County Extension for the Ohio State University; Andrew Genszler, President and CEO of Lutheran Metropolitan Ministries; Dr. Henry Ng, Director of Internal Medicine and Pediatrics at the MetroHealth System; and Kristin Warzocha, President and CEO of the Greater Cleveland Food Bank. Please help me welcome the panelists. So, Kristin, let's start with you. I briefly mentioned the numbers of who's going hungry here in Northeast Ohio, but I want to give some more numbers from the Greater Cleveland Food Bank's annual report. In 2016, more than 57 million meals were missed in the 6 counties that you serve, and your organization provided just over 50 million meals last year. But the face of hunger has changed, and it's not just in the inner city, it's not just minorities. Can you talk about the changing face of hunger?
Oh, absolutely. Darrielle, thanks for hosting us today, and to everyone at the City Club. It's wonderful to be here to have what I think is a very important conversation about an important topic. The fact is the face of hunger has changed over the years. At the Greater Cleveland Food Bank, we're still serving more people today than we were before the recession. We're doing that in partnership with 800 different community partners across 6 counties. But you know, it's interesting when we go out and visit those sites and visit those partners, one of the things that I notice when I talk with clients standing in line is that we're seeing more and more seniors, for one thing, and also more and more people who are working but poor. There's some research that comes out annually about the most popular jobs in the state of Ohio. And of the 13 most popular jobs, so the jobs with the most Ohioans in them, only 2 of them for a full-time employee pay a family-sustaining wage. And so we see so many people who are really struggling. They are working full-time or part-time, but simply can't get by. Their budgets are too tight, and so either on a regular basis or from time to time, when there's a family emergency, they end up in line at a food pantry.
And Dr. Ng, it's tough. It's a tough choice that many people have to make, paying for food, housing, medicine. Can you just talk about what happens to the body to someone who's healthy? Let's start with the healthy people.
Sure.
If they only get a nutritious meal once or twice, or maybe a week out of a month.
So, and I think I'm speaking to the effects of food insecurity, both on the effects of families, but for children and adults, because I'm a pediatrician and an internist. So I'm thinking about the nutritional impact that lack of adequate nutrition has on learning, for example. So a young person who's going to school who is distracted in part because they really are hungry and also do not have enough nutrition for the optimum growth of their nerves and their brain can have a difficult time learning different concepts that maybe their peers who are getting more nutrition are able to learn. It'll affect their growth. It'll affect other elements of development, and ultimately that may affect a person's ability to get a gainful job or to optimize their career goals and to be able to achieve what they want to achieve. And I think that's a very important thing that we do to provide nutrition for all of our children in this country, especially in our community, so that we can have the next generation of leaders who are able to lead us and take care of us. And without that nutrition, it's really dangerous for them. It's challenging for them. For our adults in our community who otherwise are healthy, we can start to see some changes happen as they're switching, exchanging foods for perhaps nutritious foods for things that are more affordable, maybe fast foods or convenience foods, things that may not have as much nutritional value. And over time that can contribute to gaining weight and obesity or developing high blood pressure, hypertension, increased cholesterol levels. And unfortunately for those people who also smoke, that might increase their risk or chances of developing heart disease, cerebrovascular disease, or strokes, and other types of major health problems. And these are the things that, again, as health professionals, our goal is to improve the health of the person in front of us, but also improve the community health.
Right, and you were saying, so if there's someone who does have a chronic illness and they're still not getting the food that they need, this could compound their illness.
Absolutely. So if a person, for example, has a health problem that affects their heart, maybe they've had a heart attack already and they live with congestive heart failure. Their heart is not as strong as it could be, as it once was. And if they have a diet, for example, that has high sodium foods, which again are very frequent and plentiful in many different areas where we're trying to buy food, in our food deserts, where fresh fruits and vegetables are less available. We're making choices of survival. However, these foods may make it more likely that we actually have worsening of our underlying health conditions, worse heart disease, having a heart attack, or perhaps even dying.
And Drew, Lutheran Metropolitan Ministries, they help fill that gap that Kristin was talking about, with SNAP placement. And SNAP, just for those who don't know, was Supplemental Nutritional Assistance Program, which is basically food stamps. So it helps them get the food that they need with assistance from the government. And you guys help with placement because when they're on SNAP, they need to fulfill some requirements. Can you talk about what LMM does with that?
Yeah, sure. We're so glad to be here as part of this conversation today. Thanks to the City Club for having us and our sponsors. And we have a terrific staff here with our board members, and they're the ones who keep the trains running. Essentially, I just get to talk about these great stories, so thanks, guys. Yes, we're at Lutheran Metropolitan Ministry. We have to take a quick step back and let you know that we do operate a large job training kitchen. We operate that as job training, but it also is a production kitchen, and so we produce about 2,000 meals a day for several sites around the city. We do that as a partner and a redistribution center of the food bank. And so we source a lot of our food from the food bank. We're doing the creation of meals essentially, and then we send them out the door to a variety of places. But part of our workforce, a large part of our workforce, comes to us via the SNAP program and the county's benefits system. As Darrielle noted, the SNAP program is a Supplemental Nutrition Assistance Program. Many of you know that nowadays, as part of receiving a food assistance benefit, you must also be working on a community service or looking for a job or in some sort of job training program as well. And so LMM has stepped up as a primary placement for people both in what they call rapid engagement, which is people who are receiving food assistance. They come through our doors, Darrielle, so that we can essentially engage them and integrate them into the kitchen workforce. And some of them are awaiting placement in other longer term community service opportunities or job training. And then there's also a work experience program, and they too are integrated into the kitchen workforce. So essentially I think we have 68 spots, for the rapid engagement, 53 for the work experience engagement. All of those spots are full, constantly full. These are people coming through a benefit system and receiving some kind of job training effort at Lutheran Metropolitan Ministry. And I think the point of that is, through these great partnerships, is that we're trying to take advantage of what is a food sort of benefits system, the benefits stream, if you will, and create an economic opportunity out of that, create a synergy out of that, and create some economic development out of that system. And I think that's something that we're really planting a flag on and really proud of.
Yes, well, great. Well, great, good work. And Nicole, with the Cuyahoga County Extension of The Ohio State University, you guys really work at trying to get some urban gardens, so then that could also help with the gap, and also teach people about fresh fruits and vegetables. Can you just explain?
Yeah, so first I want to say thank you for having me here today. Just like Drew, I have a band of people that do the work, along with great partnerships with community organizations like the Prevention Research Center at Case, the food bank, our hospital systems, as well as Lutheran Metropolitan Ministry. So I just wanted, before I speak on anything, give them credit for the hard work and partnership that we've been pretty successful at. So yes, within the city of Cleveland, we currently provide support for almost 200 gardens. We have done that this is our 32nd year. So within that, we help residents learn how to not only grow their produce, but how to prepare it. So that ties into some of our nutrition education programming, which is specific to those who are SNAP eligible and receiving SNAP. So we provide that nutrition education from preschool up to our senior citizens. We also have urban ag workshops, which we help, again, the basics of starting a garden. So space analysis, garden design, soil quality, all the way to how, if you want to, sell your product. So if you have bees, how do you sell your honey? If you want to make tomato sauce, how do you do that? Food safety regulations and issues are also taught as well.
Nice. And with that, Kristin, I know that the food bank has worked really hard on trying to get more fresh fruits and vegetables into the bags of people that you assist. Can you talk about that?
Absolutely. For a number of years now, we have been really working to make sure that the food that we distribute through the food bank is as highly nutritious as possible. And that means distributing many more fresh fruits and vegetables, as well as other perishable foods. That's some of the most nutritious food we can make available, and yet it can be also difficult for a food pantry to distribute. And so we've been developing creative ways and creative partners to get that out. But last year, we provided about 27 million pounds of perishable food. 19 million pounds of that was free, fresh produce out in our community. And we're doing that for a wide variety of reasons. One, of course, is because of food's impact on health and nutritional value. Another is because, as was said earlier, nutritious food is some of the most expensive food to afford. And so for families or seniors living on very tight budgets, they tend to shop in the middle of the supermarket, the center aisles, because they're the things that are starchy, that'll fill you up, that will last longer. And so there are some kids in our community who have not had the opportunity to try things that the overwhelming majority of the population gets to enjoy. I was out at one of our agencies, one of our partners last summer, MedWorks actually, distributing food to clients who'd come in for a health clinic, met a 7-year-old boy who'd never tasted an apple before. He said, "What's that taste like?"
Wow.
And so, getting this food out is just of critical importance.
Right, and with the gardens, if a child is planting an apple or a tree, but or fruits and vegetables, then they'll be more apt to trying it, wouldn't you say?
Yes, and so between our community gardens and our nutrition programming, we often expose, that's their first time being exposed to a lot of different produce, specifically the fall, right? When all these different types of squash are available to us, we don't know what they are sometimes. And so we try to help educate around it's okay to touch it. Some of them don't look so pretty. And then it's okay to eat and how to prepare and different ways to prepare and store. So we do the same thing at our farmers markets. We work with the vendors at the farmers markets to educate their customers on what they're buying and seasonality and other issues around or not issues, but topics around preparation, and it's okay to try it.
And one thing that I just find so great is that MetroHealth is going to get a food bank within the hospital. I know you guys are working on it. It's still, I'm planning, but using food as medicine. I mean, you think that sounds like a new concept, but it's actually really old, that you should use food before you try medicine to heal your body. Can you just talk about how you guys are doing that?
So the food pharmacy or food as medicine program that we're developing is something I am very, very excited to be a part of. And it really began as a partnership between MetroHealth and the food bank about a couple of years ago, when our executive leaders had a chance to begin a working relationship and realize that we have a shared mission and vision in improving health and also decreasing food insecurity all across our community. And I was told by Dr. Boutros that we need to work on this, so it became duties otherwise assigned. And I said, well, of course we'll make it happen. So it's actually been a wild ride because, again, as a physician, this wasn't a great deal of my experience in training. I had a little bit of nutrition experience when I was a medical student. I had worked with nutritionists and registered dietitians a great deal when I was a resident, but understanding kind of the social level of food insecurity and thinking about nutritional impact on both health promotion and disease prevention from a global scale, that actually was something that most of us have not had a chance to spend time and energy in. And I think even in nutrition, we're usually focused on that individual, and you're not thinking necessarily of an entire community or larger sets of communities within a geographic area. So we've had an opportunity to first learn about other models. So we learned about the Boston model that had placed a food bank inside of a hospital system, and they've been very successful. We wanted to build upon that experience and kind of tweak it and make it our own. So we had a recent trip to Toledo. We went to ProMedica with Kristin and others. And it was an amazing, eye-opening trip where we had seen how another hospital system has begun to, again, create this space where we can prescribe food to patients who need it for the reasons that they need it, not just for food insecurity, but also for their specific health reasons and to improve their health. And this is actually one of many programs at MetroHealth Medical Center that have been going on for about the last 2, 3, 4 years that have been addressing various areas of health and food, whether we're talking about issues related to obesity, the obesity epidemic in our adults and children, with our program for pediatric wellness and for our adult weight management program, or our school health program that's partnered with the food bank to also help deliver food at the various schools, or the various programs in around town like Vita and Quarry that are going on. They're very, very important. So this is yet another important program that we're launching, hopefully to start this fall. And our goal is to be able to develop an on-site food pharmacy with an opportunity for our clients and patients to experience food selection, food choice, that this will help people develop the behaviors that are positive in food selection for their own health. And frankly, we also want to take away a lot of the stigma that's associated with using food pantries and whatnot. A lot of people feel uncomfortable or less comfortable using so if they're not speaking English as a primary language, or they may come from a different cultural background. They may not feel that this is as accessible for them. We want to encourage all individuals to be able to use these resources as appropriate.
Great. Well, can't wait to see it. And Drew, let's talk about the relationships that LMM has with area congregations and so how you work with them to educate people about healthy choices.
I appreciate you mentioning that. We've begun a congregation, and those of you who are members of a congregation regardless of faith know when you've seen one congregation, you've seen one congregation, basically. I mean, they're very different contexts. But we've really been interested and engaged in now a 15-member congregational organization member hub, essentially, in the east side of Cleveland, largely urban congregations. These are congregations that have really an outsized influence in their neighborhood, in their blocks. And so we've begun a kind of health hub model where we've introduced an anti-obesity curriculum and some new dietary challenges for the members there. And it's just amazing to see both the kind of on-site leadership and then as well as the kind of general culture change. I don't know about some of you, but I grew up in church basements. My father's a pastor, and I can tell you that most of what we ate in church basements, let's be honest, after the service, is not terribly healthy. But slowly, these congregations are pioneers. They have a vision for healthy eating that would put most of the congregations I was in to shame, frankly. I still love, the bars that the ladies would make. I love that stuff. But to Dr. Ng's point too, we've been so pleased with the partnership that we've struck up with the extension. A lot of the folks I mentioned who come through the training program also have a life skills component. And part of that life skills component increasingly, and we find one of the most popular parts of that life skills component is the nutrition and education training that Nicole might say more about. But it's such a great partnership where we're a site essentially for education on nutrition and being able to touch the squash, as you say, and really opening up a whole new kind of culinary vision for people that happens to be healthy as a nice byproduct.
So Drew just kind of teased it. Talk more about the education program that you guys have.
So our nutrition education programs range anywhere from 6 to 12 weeks, depending on how long an organization wants us there. We're often asked to come back. So we start off with the basics of how to read a nutrition label. We go into, maybe you shouldn't buy products with ingredients you can't pronounce. It also incorporates some physical activity as well, so chair yoga, different exercises depending on the mobility of the audience that we're teaching at that time. We offer culinary incentives for a lot of our participants, so we do teach like kniving skills. We don't give out knives. We're not allowed to do that. But, so they can go home and have those skills. One of the things which I learned when I started this job is you shouldn't put a tomato in a refrigerator. It doesn't last as long. So those little things that we think we know but may not know, our nutrition education makes it fun. For, again, like our preschoolers love it. We're in CMSD. We have a great partnership with them. So we try to make sure that each elementary school student, K through 5 anyway, receives our nutrition education.
Great. And let's just talk about kids real fast. Now that it's summer, they're not getting the free or reduced lunches at schools. So Kristin or anyone else who wants to chime in, how are you guys helping the kids during the summertime to get fed?
Sure, I'd be happy to address that one and anyone else chime in. One of the things that we're doing this summer is providing meals through our on-site kitchen in partnership with LMM, who's helping us make some sandwiches, to 109 summer meal sites. These are sites where low-income children, when they're out of school for the summer, who don't have access to free and reduced price school lunches, can go to get a meal. At every site we provide lunch. At about a third of the sites we're also providing breakfast. The reason we added breakfast is because when we first started the program a number of years ago, at the end of the summer we did a survey of the children who participated. Very simple survey. And one of the questions on the survey was, how many meals did you have today? And we were surprised at the number of children who reported 1. And it was the lunch that they had with us. And so now with any site that can do breakfast and lunch, we try to do that. And that's only possible because of the great support we get from the community, because of federal reimbursement, and also because of volunteers. Volunteers are making those breakfasts and lunches every day back in our kitchen. And got some volunteers with us today.
Okay. So let's talk money. So budgets. The Ohio Senate just passed their budget on Wednesday, and then the federal budget's working its way through. How is that affecting your bottom lines in providing meals to people or educating people?
Well, I can speak on it from a SNAP incentive or SNAP perspective. So for us, we focus a lot again on SNAP incentives. So we provide that incentive for people who receive SNAP benefits to purchase produce at farmers markets. So we currently have 31 farmers markets in our network. The program is called Produce Perks. So for us, trying to be a permanent part of the budget as far as SNAP incentives is very important. So there's a statewide nutrition incentive network that has recently been formed. The Ohio Department of Health is at the table with us to support our advocating for this to be a permanent line item for produce perks as well as produce prescription. So we do partner with MetroHealth Hospital, Cleveland Clinic, as well as some neon sites to provide this same incentive that we call them vouchers for those diagnosed with hypertension and new moms. So for us, the state level, the Farm Bill is expiring soon, so in the next few months, we're going to ramp up our advocacy efforts around that.
And if I could add in, you know, the fact is that state and federal funding is incredibly important to our work to eliminate hunger. And so things have been happening and changing by the moment. In the state budget, there are two things that we've been paying particularly close attention to. One is State of Ohio Food Program, which is funded at $19.5 million a year. It is flat funded in the Senate version of the budget. When I mentioned earlier that we provided almost 18 million pounds of free produce, or 19 million pounds of free produce last year, a lot of that produce came from Ohio farmers using dollars from that program. And so we were hoping for an increase, frankly, because we know that there's more need, and because we can buy that produce from Ohio farmers. We're buying surplus at about 23 cents a pound. So it's really a great investment. Right now, that is flat. Another program that we've been watching closely is a block grant, a senior services block grant. And the reason it's important is because it funds Meals on Wheels programs. Back in 2001, it was funded at $15 million a year. It is at an all-time low since then. It's now at about $6.7 million, we think. Came out of the governor's budget around $7 million, but then there were some across-the-board cuts. So it's looking like it's a little bit lower. And the fact is, Meals on Wheels are critical to low-income seniors, particularly at a time that the number of seniors is skyrocketing. Our local Western Reserve Area Agency on Aging, which essentially funds all of the Meals on Wheels programs for low-income seniors, this stat blows me away. Back in 2000, they're serving 611,000 fewer meals a year than they were in 2001. In our service area, because state and federal funding has not kept up with rising costs and also the rising number of seniors. And so those two things are important. That's just the state budget. There's more on the federal front. But
do you want to share some? I know you've been to D.C. a lot to lobby.
I have. On the federal front, President Trump's budget has proposed a 25% reduction in costs for the SNAP program. That is something that causes us significant concern. SNAP is our nation's frontline defense against hunger. It's a very effective program. It's a very efficient program. And the fact is, the SNAP program provides 10 times the meals that every food bank in the United States provides together. So a cut of 25% is something that absolutely cannot be absorbed. They're also passing some of those costs along to the states, and I think many of us appreciate the position that the state budget is in. These are costs that the state can't afford either. The other program in the federal budget that has been critical to food banks and to all of our partners is a program called the Emergency Food Assistance Program. It's in the Farm Bill, and it allows, essentially the federal government buys surplus products from farmers and then distributes them nationwide. There is a proposed decrease in funding for that program as well. So if there are cuts to SNAP and a decrease in that program, as well as, frankly, cuts to housing and health care, we're going to have a big problem on our hands.
Right.
I can add on the budget, Darrielle, if I might, but really bring it back to an advocacy point, which I think we're fast approaching here. Our central kitchen really has been the recipient of some very gracious thought leadership and some funding. The St. Luke's Foundation, I see Ann here, has helped to fund that congregational health hub model I noted, but the kitchen really has received some significant funding from foundations in the area, Cleveland and others, and the Cuyahoga County Office of Reentry. So it's a public-private partnership that we're very proud to kind of represent in that way. But the fact is, Kristin's exactly right. We can't do what we do without some kind of investment from public funding. And I think we'd be the first nonprofit to say there's a philosophical commitment that needs to be made good on here. by our government. Even as I talk empowerment and I talk about economic opportunity, we need a baseline. There is chronic hunger in this country, and that is the responsibility of a government that, even if it wants to talk about strategic investment, that language is fine, but that really needs to be taken up on. One reason that we've gotten into the SNAP placement program is because we respect our county government when it says, okay, part of receiving public benefits is let's talk about job training and meaningful life skills for people who are also receiving assistance. Michelle Nahez in the back here does a great job with placement for people on behalf of the county, but the fact is that is part of a newer vision for what it means to receive something like SNAP. So I think that's an important part of what we can bring, we, the public, but we as nonprofit leaders as well, Kristin, I appreciate your work on that, can bring to this public conversation. I used to work on big government programs in Washington, and I can tell you what really makes a difference for me is the personalization of hunger. And Kristin talked about the 10-year-old or 9-year-old. I'm an active and proud member of the Food Banks Advocacy Committee because it's been personal for me. My brother and sister-in-law received food stamps at one point in their lives, and we're one of these burgeoning middle-class families, a lot of pastors and teachers, et cetera. They had an EBT card for 3 years. I know of seminarians and grad students who have EBT cards. I know of military families, as a Navy chaplain, who have EBT cards and who use them, even though the partner or spouse in that family is an employee, if you will put it that way, of the Department of Defense. They are redeeming SNAP benefits. And when you can personalize the issue like that, I think that is it's a new vision for what we talk about in terms of these programs. We can guarantee that the funding that we get or that comes through the food bank, that flows through the food bank, is being spent effectively and efficiently. And I think it's time we change that conversation.
Right, you're so correct. Well, my time's almost up, and then you guys can ask questions. I just have one more question for the panel. Let's end on a high note. Like, tell me some success stories, or where you guys really saw that your hard work really impacted someone's life and changed them for the better. Anyone can go
Sure
first.
So, do you want to take that one?
No, I said I'm sure we have them.
Yeah. So we recently, as part of our new strategic plan, where we're doing a lot more outreach to seniors and children and clients with health challenges, we started a program called our Senior Market, where we take fresh produce out to low-income seniors and also offer some wraparound services. So we recently started doing a senior market in Bay Village. It's in partnership with the Bay Village Senior Center, and we go once a month. We bring pallets of fresh produce. It's in front of a senior high-rise apartment building, which offers assistance to keep the rents low. Any senior living at less than 200% of poverty, which is about $20,000 a year for a single person, can come down. And we have 125, 150 people who come every month who are seniors. And recently, our senior services specialist at the food bank told me that she was approached by a woman in a wheelchair who said, I'm just so grateful you're here. People don't realize that we need help out here in the suburbs too, and this food is going to make a really big difference for me and for all my friends who live in this building. So, sometimes I think there's the perception that hunger is an urban problem. Unfortunately, it's a problem that spreads throughout our community.
Anybody else? No?
Just one quick one.
Okay.
Whenever I show up on one of our sites, people think I'm there to fire somebody usually, so everybody runs to the hills. But, no, I'm just kidding. But I often go, especially walk through the kitchen to, isn't that right, you guys? I mean, that's. I often walk through our kitchen to get stories, to talk with people for 5 minutes at a time. You cannot walk through our building for more than 5 minutes without someone. Everybody's got a story, right? But with someone telling their story. And just one in particular, a woman named Mary who had come through the SNAP placement program, discovered, she was just there to work and be placed somewhere else, but she rediscovered a love of cooking, and it connected her to her mother and grandmother. And it ends up that she then went through training and is now our central kitchen supervisor, and is loving that. It's not just such a burden for her, but it's something that really she grew personally in that experience as well.
Oh, great. Good. You guys good, or you guys want to tell? No? No? Okay. Well, today we are enjoying a Friday Forum panel discussion on food insecurity in Ohio, featuring Nicole Debose, County Extension Director at the Cuyahoga County Extension of the Ohio State University, Andrew Genszler, President and CEO of Lutheran Metropolitan Ministries, Dr. Henry Ng, Director of Internal Medicine and Pediatrics at the MetroHealth System, and Kristin Warzocha, President and CEO of the Greater Cleveland Food Bank. Now, we're about to begin the Q&A session. We welcome questions from everyone, City Club members, guests, students, or those who are joining via our radio broadcast, webcast, or live simulcast from the Parma Snow branch of the Cuyahoga County Public Library. Now, if you would like to tweet a question, please tweet at the City Club, and our staff will try to work it into the program. And we want to remind you that your question should be brief and to the point. Holding the microphones today are Content Coordinator Teddy Eisenberg and Director of Programming Stephanie Jansky. We will take the first question.
So when we talk about food insecurity, what are we talking about? Are we talking about fighting hunger, or are we talking about fighting obesity?
I have one answer. Yes. We're talking about both a maldistribution of food amongst populations in terms of having access to healthy foods that contribute to the obesity epidemic. At the same time, people who are obese experience malnutrition. They can have chronic health conditions, lack of important nutrients that ultimately affect their health too. So excess calories doesn't mean excess health, as we all know. So it's an issue of looking at both individual interactions with food as health behaviors, but also as a society, how do we improve the ways that all of us can access healthy foods when we need them, which is always.
Mm-hmm. And food insecurity is a term that was coined by the Department of Agriculture a number of years ago. And really what it means is someone who doesn't always know where the next meal is coming from. And so I think that when folks don't know where their next meal is coming from, they do things like try to stretch their budget by skipping meals or by accessing really unhealthy food because it's all they can afford. 80% of the clients that we serve report knowingly purchasing less healthy food because it's all that they can afford on their limited budget.
Hello. The state recently did an assessment on Ohio's Medicaid expansion and showed that 60% of those expansion enrollees saw a decrease in food insecurity. I just want your perspectives with the state freezing enrollment and with the federal government not only ending expansion but also severely limiting eligibility generally with Medicaid. What do you see as happening in terms of food insecurity if Medicaid as an entitlement ends, and specifically what happens if Medicaid expansion ends?
You want to take that one as the healthcare professional?
I mean, I think on both individual level and the population health level, I'm very concerned that we'll see food insecurity become worse. We'll see individuals making exchanges and decisions of, can I afford the food, or can I afford my medication, or can I afford my transportation to go see the doctor, or can I afford where I live? And these are the day-to-day exchanges that my patients, people in our community, our friends, our neighbors, our family members may experience. And more people, I'm afraid, will fall through the cracks. And we may see population health and individual health actually worsen. I want to take the flip side of this, though, and actually just reflect on the program that we're trying to start at MetroHealth. One of the things that we're trying to do is actually look at outcomes that will go beyond amount of food delivered, amount of hunger, or degree of hunger that has been addressed. We're actually looking at the opportunity to measure and try to connect health outcomes for one of the first times. There's very little scientific literature that actually looks at, if you provide food for individuals that's healthy, does it actually improve their health on the long term? You would think that there should be a lot of science about this, but there hasn't been a lot of studies done. So we're hoping that we'll actually get some science out of this, and science can inform policy. And as this country, we need science. We need facts. Real facts is all I'm saying.
If I might, Lauren, I appreciate that question. It's good to see you. I think just a quick footnote that we also are in we have a lot of people who come to us for a variety of mental health, behavioral health, and other kinds of programs who receive Medicaid assistance. And I remember years ago working on something called the Community Development Block Grant. it's almost impossible to advocate for the Community Development Block Grant because it funds 50 different things. There's no poster picture of what the CDBG does. And I think Medicaid suffers from a similar kind of anonymity, if you will, in public life. So it's hard to get your head around what the breadth of Medicaid does in the state of Ohio. But yeah, it's clear under expansion. I was pleased to sign on to a letter with 2 other CEOs yesterday to be placed in the dispatch today about what we'd see in terms of Medicaid, not only the entire slashing of Medicaid, but the rollback in Ohio of what we've come to know as expansion.
Hi. I have 2 questions, both of which will be, fortunately, fairly easy and quick to ask. One is, our kids in East Cleveland not only get free breakfast and free lunch, but they also get a free fresh produce snack. And I'm wondering how widespread that is. And the other one is that I keep hearing from people I know who work in food banks that it's sometimes hard to get people to take the fresh produce, which goes back to the cooking issue. And I know there are cooking classes and there are cooking demonstrations. What can we do to increase the cooking classes? Thank you.
Well, I'll try to touch on both of those briefly. So my partners at the Board of Health work a lot on farm to school, and a piece of that is providing produce as snacks. So I think last year some of the food safety laws and regulations changed. So for example, providing an apple for a snack, the apple had to be individually wrapped, which causes an expense not only for the plastic wrap, but for human capital and actually wrapping the apples. So that is a challenge, but I do think that with advocacy efforts, that's something that we could change, right? And then as far as cooking and culinary demonstrations, there is a huge need for that. I think there would need to be a community-wide strategy set around that, because there are a lot of pockets of us doing this work, but how can we make it effective in reaching the majority of our people, right? So I think as organizations we provide it, but it would be good to have a larger program or project that offers it at a low, right, or for low cost or free for the residents, and I think they would definitely take advantage of that. We get requests for that all the time.
One of the things that we have been trying to do for a number of years now is we added a nutritionist to our team, and she has a whole team of dietetic interns. And so they're out in the community when we're doing these mass produce distributions, for example, at schools, at senior high rises, in food deserts, doing things like cooking demos, so that if one of the items that we have to give away is spaghetti squash, we can let people sample spaghetti squash, which perhaps they haven't had before, or provide a recipe for spaghetti squash. Because, if there's a food you're not familiar with, you're much more likely to pass it by. And frankly, people don't want to waste food. I mean, we see this all the time. Someone will say, no, my kids won't eat that, or no, I don't know how to prepare that. I'm going to leave that for the next person because they don't want it to go to waste. So I think that education is absolutely critically important.
Good afternoon. You spoke briefly, Dr. Ng and Kristin as well, about food deserts, and I was wondering if you could talk about food deserts. There's a Giant Eagle in the Buckeye neighborhood that closed down. They're planning on having another grocery store there, but the people that live in that community have to take a bus to go get their food. So if you could touch on food deserts and maybe advocacy and what could be done.
Sure.
Oh, you go first.
You want me to
I got the first one for the last couple.
Good for you. So essentially a food desert, for folks who are not familiar, is any part of the community where a grocery store essentially is not within, I can't remember, a mile, a half mile, but it's hard to reach the nearest grocery store. And so there are many places in our community where the only groceries within a reasonable distance, are little corner stores, which don't have a lot of fresh fruits and vegetables, or fast food, right? Which is really inexpensive and easy for a family to access. And so, I think that's a challenge because to have big grocery stores in a food desert, there need to be enough shoppers who can afford to buy their groceries at the grocery store. And so one of the things that I think could contribute there is making sure that everyone who is eligible for SNAP is enrolled in the program and has access to the program. Because we talk about SNAP as first and foremost a hunger relief program, and it is, but it's also providing important economic dollars. It's federal dollars that are being spent at supermarkets and allowing people to access more nutritious food. So one of the things we've been doing is trying to help people apply for SNAP, the SNAP benefit. Last year, we completed about 20,000 applications for clients in the 6 counties we serve. But I think it's also about thinking creatively as a community to try to get as much nutritious food into those parts of the community as possible, whether that's through a farmer's market, whether that's through one of our free produce distributions, a member agency, and other ways.
Right. Other cities have also taken some unique advocacy toward addressing that issue head on. For example, in Toledo, ProMedica, as a health organization, recognized that they had a food desert, that many of their clients and patients had to not just get on one bus, but multiple forms of transportation. And unfortunately, their city doesn't have the strong infrastructure for public transportation that makes it easy for people to both get to where they need to go and carry the groceries with them. So they worked together with other organizations and they came up with developing a supermarket. And they put a supermarket in a community where there wasn't one. So I think that, I'm not saying that we do that in every single community of ours, but those are strategies that might be pie in the sky, but they can happen. But they only happen when we all come together and say, with united voice, this is a priority, this is necessary. We're already doing all these things that can maximize our dollars and really get the spending at our local grocery stores, and we're trying to maximize the use of healthy foods or purchasing healthy foods. We need more.
So if I could chime in, I am a co-chair of the Cleveland Cuyahoga Food Policy Coalition, and one of our priority areas is food and transportation. So from a local advocacy perspective, we are a group that is growing and in a position to, with support from our community, advocate when grocery stores close, or if we want to advocate for local policies or regulations around healthy food in corner stores, for example. So locally, we do have a group of people that work on these issues, so we do try.
Before we take the next question, I just have a quick, can you talk more about the urban gardens and where that produce goes? I mean, does it stay within that neighborhood? Is it given free, or do people have to pay for it?
So the gardens within the city of Cleveland are not allowed to sell their produce. So it stays within a community or it's donated. So each year we report, and I don't know the number of pounds that we donate each year, but I'll definitely say it's tens of thousands of pounds of produce that we donate to pantries and neighborhood-based centers that then distribute the produce.
After listening to our group here about cuts in the government, what can we, I mean, they sound almost insurmountable. What can we as individuals or organizations do about that? I mean, I know, call your congressman, your senator, blah, 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 but it's not just in Ohio. I would assume it's all across the entire country. We've got something going on that is not fair. It's not being done properly. You know, the rich are getting richer and the poor are getting poorer. And there's just not enough being done to help those. And I'm sure the four of you, plus our moderator, would be able to come up with some answers for that.
I can take a quick stab at that and really invite my colleagues. I know it's a big question, and so I think all of us in the room probably have a suggestion, but leave it to the pastor to come up with a little Latin. But let me break out a little Latin for you. Companion. The word companion in Latin is cum panis, to break bread with. And I think if we take a step back as a country and sit down with each other and break bread, that's not a naive thing to suggest. I think conversations happen over meals. Food is also a kind of social stimulant, if you will. It's a social common ground. Dan had made mention earlier of the common ground discussions coming up, and I think that's a wonderful opportunity for us. Those don't have to be overly pointed at first, but I think they lead to mutual understanding, which can, in fact, lead to different kinds of public policy advocacy. We are the nation, you mentioned the kind of history here. We are a nation that sponsored the Green Revolution in the 60s. We're the nation of the McGovern-Dole feeding program. We are better than this moment as a nation. And I think that it's important for us to remember that, as generous as a city as Cleveland is, we are greater still in our generosity and our compassion one for another. And I think that is, to remind ourselves of that collectively often, is a good starting point.
That was very well said, Drew. I mean, I would simply add that there are a lot of overwhelming problems in our society. You know, cancer is very difficult to cure. World peace would be very hard to attain. Hunger is something we can solve, but it requires political will. And so I think that we should call our congresspeople. I mean, I think being in front of our legislators to help them understand the depth and the breadth of this problem, and also how it can be addressed, is really critical. And so, while this is an amazingly generous community, and certainly, we need the support of our volunteers and our donors, I think that right now, at this point in time, becoming an advocate is one of the most powerful things that we can do. And there are lots of different ways we can advocate to raise awareness of this issue, to help people understand that this is still a problem, even with the recession over. We've got a group of Food Bank Advocates Network, and you can sign up to be part of it on our website. It's about 2,000 people strong, and it needs to be even stronger.
Hello. People are constantly telling me as a teenager that you are the future. So as a young person who wants to help with this issue and to stop hunger in Ohio, what do you think we should do to reinforce and further the combatants of food insecurity?
Well, thank you for asking that question. In preparation for today, I've read a lot of articles, right? And there's this movement now, which we all are a part of. We're here for local and fresh food, right? Growing our own food. And in some articles, it mentioned going back to our roots and learning how to grow our own food. So speaking, I guess, I'm not a gardener myself. I don't have a green thumb, but I think that it's important for you to learn how to grow your own food, where your food comes from, so that you know when you're not eating something healthy, when something is presented to you that's not whole. And so then you can share that knowledge with your peers and your children and even your elders, right? So I think gaining the knowledge around food and where it comes from, that's my college plug there, would be a way for you to help.
I'll take a stab at that too. Most people who know me know that I do very few things on social media. They usually include pictures of food, cats, or activism. So I would leave out the cats because that's a personal thing. But I think food and activism are actually two very important things that everyone in this room, but especially our young people, can think about. Food is something that brings us all together, as we've heard. It's breaking bread, it's sharing cultures, it's sharing stories, it's sharing our experiences with each other. It is something that allows us to step outside of ourselves in a moment and to see the world through someone else's eyes. And it's that passion for learning about someone else's experience and recognizing that someone else's experience at times may not be all that great, maybe because they've experienced food insecurity or its other associated problems. So I think that becoming involved and becoming aware and talking about these issues, and you find some piece of this that's really important to you, that speaks to you, And you keep on telling people. You tell them so that you're blue in the face and they don't want to hear this anymore from you. And then you go find someone else and you tell them. And guess what? The first friend that you told, they're actually going to start talking about this too. And this is the virality, the viralness of what we want to spread in terms of this message. And this is the base that we can make change happen. It starts with us.
Well, I want to thank our panelists, Kristin Warzocha, Dr. Henry Ng, Andrew Genszler, and Nicole Debose for a riveting discussion. Let's give them a big round of applause. Today at the City Club, we've been enjoying a Friday Forum panel discussion on food insecurity in Ohio. Today's forum is presented by Citizens Bank. It's also part of our Local Heroes series sponsored by Dominion Energy. We appreciate your continued support of City Club programming. Our community partners are the Lutheran Metropolitan Ministries and the Center for Health Affairs. We thank all of you for your partnership. Additionally, we welcome guests at tables hosted by the Greater Cleveland Food Bank. Lastly, we welcome students from Brookside High School, Flow Homeschool Co-op, and Shaker Heights High School. Student participation in the City Club Forum is provided by many foundations, including the William E. Weiss Foundation. We thank all of you for being here today. And that brings an end to today's forum. Thank you again. And thank you, ladies and gentlemen, for being here today. Thank you.
For information on upcoming speakers or for podcasts of the City Club, go to cityclub.org.
Production and distribution of City Club forums on ideastream are made possible by the generous support of PNC and the Raskin Family Fund, with additional funding from Cleveland State University, Robert Conrad, and the Payne Fund.